Yeah, so what is the difference between a dermatologist and a trichologist?
Yeah, so a dermatologist also deals with hair, okay, but after our post graduation, sometimes we do fellowships. So the one who has done some fellowship in hair becomes a trichologist. So you can do either fellowship in hair transplants or medical trichology that way. So there you.
Let's talk about hair loss because I think in today's time, even personally, I am dealing with hair loss.
Yeah.
So I'd really love to know more about hair loss.
Yeah.
So, very first question to you:
Hmm.
what are the major causes for hair fall and hair loss?
Okay. So before we come to the major causes, let's understand different types of hair loss.
Of
Okay.
course.
Yeah. So there could be like, scarring types of hair loss and a non-scarring type of hair loss. When I say scarring, it means that your scalp skin has some pathology which leads to the hair loss. So in that situation, that's a completely different gamut altogether. Now coming to non-scarring, which we see common in our practice. So in non-scarring, we can broadly divide it into alopecia areata, patent hair loss, telogen effluvium, and anagen effluvium. Now I know this is a lot of medical jargon here, but let's simplify the things.
Right.
Okay, so let's start with alopecia areata. Okay, this is a condition where you see a sudden hair loss, and that will be in patches, like there would be round different patches located at different locations in your scalp, maybe eyebrows, beard, your body hair. So there will be a nice round small patch of a hair loss. So it is a sudden in occurrence, and here the common cause is your immune system. Okay, so it's your immune system which fights against the hair. Generally your immune system is supposed to be fighting against the germs, right? The bacteria, viruses. But sometimes, because of some internal issues, they start fighting against your own body tissues or organ, which is comes under an autoimmune spectrum. So that is alopecia areata. Now the treatment line here will be completely different, and patients need to be aware because they generally treat it as a normal hair loss, but that is where the time becomes crucial. It is very important to initiate the treatment early to get a complete regrowth of hair. The second type is a patent hair loss, which is very commonly seen. Now, a patent hair loss is the normal baldness which we see. So, it could be in a male pattern or a female pattern. Now, when I say male pattern is when the hair starts to grow from your sides, from your vertex, as soon as people enter their 20s and surprisingly 30s, जो पहले 50-60 इयर्स पे होता था, अब जो अर्ली एज पे दिखने लग जाता है कि साइड से थिन होने लगते हैं, यहाँ पे थिनिंग शुरू होता है. Now, in the patent hair loss, hair fall major complaint नहीं होता है, but the thinning part, like the hair is going in a particular pattern, that is a major issue over here. So, the causes of patent hair loss is hereditary. If it runs in your families, definitely there are chances you will get it. Or hormonal issues, like in female, if there is PCOS, okay. So, all this thing can lead to patent hair loss. So here the treatment line is completely different. Over here we have options like your PRPs or your hair transplant. We might need to start on some hormonal treatments to regrow the lost hair. The third common type is telogen effluvium, which is what we very commonly encounter in our practice. So over here, hair loss is a major issue. Like when patient says कि bunch में hair जाते हैं, okay, that is your telogen effluvium. Okay, so what happens in telogen effluvium is it can be divided into acute or chronic. So if it is less than 6 months of hair loss, we call it acute. More than 6 months, it's chronic. So acute, the major reason is any kind of physical or mental stress. Okay, so 3 months prior to the occurrence, 2 to 3 months prior to the occurrence of the hair loss. So today, if I get some physical stress or a mental stress, the effects on the hair will be seen 2 to 3 months later. Okay, so it could be your COVID infection, your typhoid infection, malaria, dengue fever. These are kind of physical stresses on the body. Mental stress is your anxiety, depression, or if you are having a major shift in the place, or if there is any major job change, job stress, all these things can lead to telogen effluvium. The other common causes for this would be even the medications, like if you are taking any medication for arthritis, depression, gout, all these medications also after 2-3 months of usage can lead to hair loss. Now coming to chronic. So chronic hair loss which is more than 6 months is generally caused by some nutritional deficiencies. Now nutritional deficiency as in your iron might be less, your vitamin B12 might be less, vitamin D, some thyroid abnormality, or your hemoglobin might be down. So all these parameters contribute to your chronic hair loss. Now coming to the fourth type which is anagen in which there is sudden loss of complete hair. And this generally occurs in cancer patients who are on chemotherapy or radiation therapy where 1 to 2 days of starting treatment there will be sudden hair loss. So that's the fourth type. So these are the different types and different causes of the hair loss.
So if you want to, name the top three causes, common causes for hair fall or hair loss,
Yeah.
what would be the three main causes?
Yeah, so the first most common cause, surprisingly, which I find in my practice is the nutritional deficiency. Like people have a lot of underlying vitamin D deficiency, vitamin B12 deficiency, iron deficiencies. Because we do not have regular blood checkups done in this aspect, it often remains subclinical. That is, it just doesn't come up until patient starts with the hair loss. Second most is the mental stress in day-to-day life. There is some job stress, there is some shifting stress. So all these things leads to commonly presents to us. And the third is pattern, the hormonal changes. Because of the changing lifestyle, more of a sedentary lifestyle, we do have some hormonal issues. So we lead they lead to early manifestation of your pattern hair losses.
Thank you so much for sharing that. I'm sure there are a lot of people stressing about hair loss.
Yeah.
For now, that is an answer. Stop stressing to not
Yeah.
have hair loss. So now, doctor, now that we know what are the causes of hair loss, if you can just tell us, how can we prevent hair fall?
Okay, so for preventing hair fall, first, like we need to have a healthy lifestyle. Okay, and by healthy lifestyle, I mean avoid all crash diets. Okay, regular gymming, have a high protein diet. Okay, it should be also a balanced diet. Like all your, you should get proper amount of iron, vitamin B12. You should take your supplements regularly. Okay, get your blood checked every 6 months, especially for the parameters which I mentioned, so that if there is any deficiencies you can catch it up in an early phase before it goes into the hair loss. Stress less. uh, yeah, mental health, you should give priority because ultimately it does affect your hair, so that will also help in preventing the hair loss. Apart from that, regular hair combing, massaging, because massaging once in a while, it helps to improve your your blood circulation to the hair, so that will help in preventing the hair loss, better growth of hair.
Oh, thank you. And if there are say top five things that we should include in our diet to prevent hair fall, what would those be?
So foods containing high iron, okay, so they should be included. If you are non-vegetarian, then fish. If you are a vegetarian, then vitamin B12 supplements can help you, okay. Then vitamin D supplements, because somehow all of us are deficient in vitamin D. A good protein intake, okay, and your nuts like your dry fruits and all, they help. Soya bean, all these things, they help in good hair growth.
Now again, so a lot of times when you after you're done with your bath,
Yeah.
and you try to dry up your hair, you see a lot of hair strands in your towel.
Yeah.
So how many strands do you think, or when do you think it is alarming
Yeah.
to witness this hair fall?
Yeah. So normally we do shed 50 to 100 hairs, okay, in a day. It is normal because those, until and unless the hair sheds off, a new hair will not grow in its place, okay. So up to 50 to 100 is normal. But if it is beyond 100, then yes, it's alarming. But all said and done, we are not going to count the hair. So a rough estimate, you know yourself that okay, normally this many hairs are shed, but when it starts to go in bunches, or you see at multiple places, like you see it on your pillows, you see it on your shirts, that is when you should be alarmed that okay, now I'm having an active hair fall, I need to visit a dermatologist or a trichologist.
Okay. And how do we take care and prevent this hair fall? Like, should we visit a doctor, or do you suggest for this we can even do home remedies? Okay, so if the hair fall is at an alarming rate, then we suggest that you visit a doctor, because
it's important for us to stop the hair fall at an early stage so that the hair growth starts and there is no hair thinning which is visible. Okay, so but if it's like a normal, you feel, then certain home remedies like rosemary oil, or for that matter a high protein diet, definitely helps for a healthy hair.
I think that was definitely a very insightful conversation with you, and thank you so much for sharing all of it.
Sure.
Thank
Thank
you.
you. Yeah.